Over the last 24 hours, we have confirmed an additional 190 cases, bringing the total in Alberta to 5,355. We have now reached 148,937 tests completed in Alberta to date, with 5,051 new tests since yesterday. I am also pleased to report the number of recovered cases in Alberta has increased to 2,161 overall. Sadly, we have also confirmed 3 additional deaths. I want to express my sincere condolences to the families and friends of these individuals. I would also like to report a death that had been previously thought to be related to COVID-19 has now been reclassified as being unrelated to COVID-19. This means the total number of deaths in the province today has increased by only 2 to 89. As I have said before, any death is a loss of someone who is loved by their family and friends. Whether their death is from COVID or anything else, each of these lives matters. The clarification provided about the counts is simply due to our commitment to transparency, but it is not meant to imply that some deaths are worth more than others. My sympathies go out to all families mourning the loss of a loved one at this time from any cause. As of today, there are now 544 cases in continuing care facilities across the province. At High River's Cargill Meatpacking Plant, there have now been 908 total cases, 631 of whom have now recovered. There have also been 333 confirmed cases among workers at the JBS plant in Brooks. I will continue to update you on these facilities as the situation evolves. While we continue to work to prevent transmissions in these outbreaks, we have seen low numbers maintained in most of the province. We cannot let up on outbreak control, but we can celebrate today what we have accomplished. Many have suffered from this virus. Lives, lifestyles, and livelihoods have all been impacted. I want to thank all Albertans for their collective sacrifices that have helped us get to where we are at today. However, our fight is far from over. We must continue to use common sense to protect each other and help prevent the spread. We're looking at the number of hospitalizations per day and the number of ICU inpatients. And we're looking at that with respect to not just the total number, but also looking at where those are. And so again, as the Premier mentioned, there may be a need to consider outbreak-specific approaches to some areas where they are seeing an additional number of cases. So we're going to be looking both at that overall number as well as at that local number to be able to make decisions about what's appropriate to do across the province and where there might be tailoring needed to address particular areas of risk.
Over the past 7 weeks, we have steadily increased the capacity of the healthcare system, and we have seen the curve much lower than we initially feared, to the point where now we have only 5% of the acute care beds set aside for COVID patients are occupied by COVID patients. So we got to the point where across the board, I think we felt a much higher level of confidence that we could begin later this month, in May, to begin relaxing some of the measures carefully and prudently. So there's a lot of numbers. It's not just people in hospitals. You know, we've obviously wanted to, for example, have a margin of confidence around personal protective equipment for the healthcare system. So we've been steadily building up our stockpiles of that equipment, and those are the numbers that we have been tracking. Now, Rick, obviously, for some people, and there are some in the public who will continue to say, shut everything down until the virus has gone away. Well, here's the reality. We're not close to getting a vaccine or a widespread and effective treatment of this disease. And we're nowhere near getting to what the scientists called herd immunity, where so many people have been infected and recovered that they can no longer transmit it. And that limits the spread. So we're nowhere near those points. And so what we need to do is manage the risk. And that's what our relaunch strategy is based on: gradual, prudent steps to open up, and we're counting on Albertans to show us that great civic-minded spirit, that personal responsibility, that caring for others in the way they conduct themselves. You know, let me put that another way, Rick. If people take this as a license to just let her rip, to go out there and congregate in big crowds and ignore the public health rules and forget about washing their hands and all the rest of it, they start holding big parties in their homes and ignoring all of the good habits that we've learned recently, well, guess what? We'll probably see a significant spike, and then we'll have to come back in and shut a lot of things down again. So one message I want to send to people is please show the kind of common sense that we've been showing as Albertans over the past few weeks. And if we do that, we'll be able to continue gradually reopening.